Thank you for joining us for Being Prepared for a Disaster When You Have Diabetes, the educational component of the doctoral project Diabetes Disaster Preparation by candidate Stacy Rory. Katrina taught medical providers a valuable lesson in diabetes management. Preparation is essential, not just for the short term during the disaster, but for the long term in the aftermath of the devastation. How primary providers prepare patients to manage diabetes during the short-term disaster has long-term implications for overall patient wellness and life expectancy. Every individual needs an emergency preparedness plan tailored to the specific needs of the individual. In the patient with diabetes, the emergency preparedness plan must include diabetic-specific instructions to minimize short-term and long-term impacts of the disaster experience. Primary providers serve as an essential role in the preparation process, as both an example of preparedness and a resource for the patient creating the personal preparedness plan for diabetes. Family care practitioners serve to empower patients and families in disaster preparation to meet the individualized needs of the family with a member diagnosed with diabetes and reduce overall lifetime complication through provision of education and resources for preparation. When disaster strikes, whether it's natural or man-made, it is important to be prepared. Be prepared at home, work, school, and in your community. On October 17, 1989, the Bay Area was hit with the most devastating earthquake in nearly a century, but the day before was just an ordinary day, like today. Be prepared for the disaster at home, work, school, and in your community. Emergency planners tell us everyone should have a plan for what they and their family members will do in case of an emergency. Step 2 is the disaster supply kit. The first things to think about for your kit are basic emergency supplies, as well as water, food, and medications, enough to last each person approximately 2 weeks. Don't forget supplies for your pets. Kits should include unique family needs such as medications, fresh water, food provisions for fresh air, basic emergency supplies, and warm clothes if you live in a cold weather climate. For patients with diabetes, consideration should also be made for well-fitting walking shoes. Once the kit has been assembled, consider personal kits for each family member. These kits, individualized for each member, are helpful if family is separated during an evacuation. Remember to maintain the kits and check expiration dates on food, water, and medications.
Emergencies come in all sizes. They may impact your entire community or just affect the lives of you and your immediate family. Either way, if you or someone you care for has diabetes, it's important to have an emergency plan. As part of your planning, prepare a portable kit that includes essential information and supplies that you would need during an event that might force you to leave home, disrupt your usual routine, and limit your access to healthcare supplies. Assemble the kit in a waterproof and insulated container to protect its contents from moisture, heat, and cold. Pack it with the following items: a list of what type of diabetes you have and details of all your medical conditions such as allergies and any prior surgery. Include details of any medications you are taking with pharmacy contact information, active prescription information, and number of eligible remaining refills. Also provide specific information about any previous diabetes medications you have taken and the reasons that you stopped taking them. Finally, as part of this list, write down the contact information for all of your healthcare providers. You should also pack a letter from your diabetes healthcare providers with all your most recent diabetes medication regimen. This is especially important if you are taking insulin. Note your most recent laboratory results, especially A1C kidney and liver tests. If possible, pack a 30-day supply of all medications taken by mouth or injection for diabetes as well as all other medical conditions. If prescribed by your physician, an emergency kit for severe hypoglycemia is essential, as are blood glucose testing supplies and, if possible, 2 glucose meters with extra batteries. Be sure to periodically check expiration dates on your hypoglycemia emergency kit. Place a small cooler in the kit large enough to hold 4 refreezable gel packs for storing insulin and unused injectable medications. So when you are ready, you can just add them to the kit. Do not use dry ice and be sure not to freeze the medication. Also be sure to pack empty plastic bottles or sharps containers for syringes, needles, and lancets. Be sure to include 1 or more sources of carbohydrates to treat hypoglycemic reactions. These could be glucose tablets, juice boxes, glucose gel, regular soda, sugar, honey, or hard candy. Additionally, take at least a 2-day supply of non-perishable foods such as peanut butter or cheese crackers or meal replacement shakes or bars, as well as a 3-day supply of bottled water. It's also a good idea to remember a pen or pencil and a notepad to record your blood sugar, any other test results, or any signs of symptoms that might suggest medical problems. Finally, place first aid supplies such as bandages, cotton swabs, dressings, and topical medications into your kit. Put it in a safe place where you can easily find it. And remember, don't pack your insulin until you're ready to go. Now enjoy the peace of mind that comes from knowing you've taken a major step to help protect yourself and your family in case of an emergency.
At least a 2-week supply of non-perishable foods is recommended by FEMA. Face masks and dense weave cotton materials for nose and mouth protection, battery-powered weather radio and flashlights, and extra batteries are also recommended. Water at 1 gallon per member per day for your family is essential in maintaining family health. Cash or credit cards and pet needs can also be included in the Diabetes Disaster Preparation Kit. Diabetes supplies to last at least 3 days are essential. An insulated bag to keep all medications, prescriptions, monitoring supplies, and emergency treatments cool and dry is essential. Comfortable footwear to protect diabetic feet is also an essential component of the diabetes supply kit. Step 3. Be informed about natural or man-made disasters in your community. Be sure to know where local fire department, police station, and hospitals are located. Post emergency phone numbers near all phones in the home. Know where utility mains are for your home, and organize and practice a family drill. It is the responsibility of all citizens to know what might occur and have a plan for what you and your family will do in the event of a natural or man-made disaster. Some disasters are easy to predict, but others will happen without warning. Planning what to do in advance is an important part of being prepared. Don't forget about your health when a disaster hits. If you have diabetes, try to stick to your meal plan and avoid unhealthy foods. Check your feet and skin every day and treat sores right away. Make sure to take and record your blood sugar at least once a day or more. Continue to take your medications as prescribed. Make sure and wear diabetes identification so emergency responders know how to take care of you. Seek medical help when needed right away. Remember, stress can cause blood sugar to rise. Seek shelter from extreme weather. Do not overexert yourself. Stay hydrated by drinking plenty of water. Follow your sick day guidelines and rest. Remember to look up local resources, the Emergency Management Office, the local health department, local police and fire departments, Red Cross and Salvation Army, and the Health and Services Resource Administration offices. State emergency resources, including the Tennessee Office of Homeland Security, can be contacted at 615-532-7825 and the web and email address listed on the slide. Don't forget the important app available for your smartphone from ReadyTN. This app can tell you where shelters are located, which shelters have medications, which shelters allow pets, can talk to you about Tennessee Department of Transportation SmartWay, where road accidents are, and can alert you to weather conditions through the National Weather Service. Download this app today and get started in your disaster plan. Federal resources, including FEMA at 1-800-621-FEMA, Ready.gov, the National Weather Service, and the Centers for Disease Control all have contact information for persons going through disaster situations. National resources include the American Red Cross and the Salvation Army.